Hi! Why are you watching this video? Well, let's see. 1. You want to learn more about substance use prevention. 2. This is an NSTP requirement. Or 3. You are passionate about helping your peers to be drug-free. You may have different reasons for watching this video, but what is important is that you are joining me right now. So allow me to maximize this opportunity to connect with you. So who am I and why am I doing this video? I am Francis Grace H. Duka-Pante, an assistant professor in health education at UP Diliman College of Education. Since 2012, I have been serving as the director of the ASEAN Training Center for Preventive Drug Education. It is an office established in 1979, funded by the Dangerous Drugs Board, and is based at the UP College of Education. The office is tasked to capacitate prevention professionals in the ASEAN with its 10 member states, namely Brunei Darussalam, Cambodia, Indonesia, Laos PDR, Malaysia, Myanmar, Philippines, Singapore, Thailand, and Vietnam. I am also a global master trainer for the Universal Prevention Curriculum for Substance Use, developed by the Colombo Plan Drug Advisory Program. Since 2015, I have been training prevention practitioners in Asia, Latin America, and Africa. I also assisted the Dangerous Drugs Board in developing the Philippine Anti-Illegal Drug Strategy, or PADS, our anti-drug plan, and the Department of Education in integrating preventive drug education concepts into the curriculum of our basic education. My presentation today will be divided into 4 parts. First, I will share a personal story related to a loved one's tobacco use and its detrimental consequences. Second, I will focus on some updates related to the prevention field. Third, I will highlight your important role in drug prevention as NSTP students. And lastly, I will suggest strategies to deliver the prevention message. Growing up, I witnessed how my uncle suffered from emphysema due to heavy smoking, which eventually caused his death at a very young age. This motivated me to be an advocate for health, particularly on substance use prevention. I want to share the message that we can choose to live well and improve the quality of our lives. At this point, let me ask you, do you believe in prevention? As I continue, you will realize that this simple question is a very crucial one. In 2020, I had the opportunity to join a virtual international training sponsored by the United Nations Office on Drugs and Crime. And Dr. Giovanna Campello, the UNODC Prevention, Treatment, and Rehabilitation Section Chief, shared an interesting anecdote. According to her, during an international meeting, a participant asked whether drug prevention works. This question left her with a burning desire to prove that prevention truly works. Thus, she spearheaded the development of a document that would summarize evidence-based prevention programs available in the world. This led to the publication of the International Standards on Drug Use Prevention in 2013. These prevention standards prove that prevention is not only effective but also cost efficient. Data has showed that for every dollar spent, good programs for drug prevention among youth can save up to $10 in treatment and other services. Evidence-based practice is anchored on rigorous evaluation and experimentation rather than on gut feeling or anecdotal evidence. Among the important evidence-based prevention principles include there should be a utilization of various settings that include the family, the school, the workplace, and the community. Second, Prevention message should be delivered positively. It should focus on wellness and do not use scare tactics or fear arousal strategies. Third, interactive strategy should be used in delivering the prevention message. Fourth, prevention services should be available for three categories of target populations, namely universal, or for all the members of the population regardless of risk, selective, or those focusing vulnerable populations, and third, indicated, which targets vulnerable individuals. These are people who have already started using drugs but they are not yet dependent. Fourth, the developmental nature of substance use should be acknowledged. Data show that the initiation of substance use is during middle childhood and early adolescence. Thus, the earlier prevention services are provided, the better. The prevention standards allow us to go beyond programs that merely advocate saying no to drugs or scared straight programs. There is no evidence that scared straight programs provides youth with first-hand experience of prison life have positive outcomes in reducing drug use. They are not effective. Also, Just Say No programs isolate students from their peer group and ignore the larger socioeconomic realities that contribute to alcohol and drug abuse. Moving on, let's talk about prevention science. Are you aware of it? If no, don't worry. Many people are not yet familiar with it. Prevention science is an emerging field that focuses on the development of evidence-based strategies that reduce risk factors while enhancing protective factors to improve the health and well-being of individuals, families, and communities. It draws from a diverse range of disciplines, including epidemiology, behavioral science, neuroscience, psychology, sociology, education, and many more. It has generated prevention interventions that safeguarded people's well-being by avoiding negative health and social outcomes such as substance use disorder. Remember, substance use is complex. Thus, we need a framework to understand it. The etiology model explains how the interaction between personal and environmental factors, both in the micro and the macro level systems, can lead to non-use or substance use, and how the systems can also be used as entry points for prevention initiatives. Through this model, we can see the link between our personal life and the social world in which we live. It helps us understand how social forces influence our decisions and behaviors, and how our personal choices affect our environment. Substance use can be a sensitive topic, especially in the Philippines. It is not openly discussed at homes, as most parents don't feel comfortable with the topic. There are also prevailing misconceptions and outdated strategies being used that can cause more harm than good. An example is bombarding young people like you with information about the nature of each substance that can actually be counterproductive, as it can arouse young people's curiosity. Another is the use of exaggerated claims and unrealistic images depicting drug effects. Lastly, the use of testimonials from former drug users are associated with negative outcomes, as this sends the message that it is okay to use because you can easily stop. Social issues like substance use affect us all. As NSTP students, you have tremendous power to contribute to the prevention advocacy. You can do this by being good role models yourselves. Be more mindful of how your action or inactions perpetuate or alleviate the issue. Adopt a healthy and drug-free lifestyle. Spread the message that the norm is non-use. Majority of people are not using drugs. Shape your peers' perception about the dangers of abusing these substances, not only to the individual, but to the community and society in general. Convey the message that substance use is multifaceted. It is a product of individual and environmental factors that come into play. It is both a health and security issue that should be managed through a multi-pronged approach. There is power in numbers, so organize yourselves to do any of the following. First, you can draft a legislative petition proposing enactment of the Republic Act 9165 or the Comprehensive Dangerous Drugs Act of 2002 to make it less punitive. Lobby for policies that would safeguard health and well-being, such as increasing age of cigarette use from 18 to 21 years old. Second, you can create anti-drug youth groups, enhance your life skills, and serve as peer educators in your communities. Third, you can develop materials and utilize social media to share these messages that inspire and empower. Use positive approach. Teach people not only to say no, but how to say no. Utilize theories of persuasive communication to convince people that your message is worth believing. Fourth, fight stigma and discrimination. It is important to use non-stigmatizing language. Call them people who use drugs, not drug addicts. Fifth, you can make a health research proposal on how we can safeguard Filipino youth's health and well-being. To our NSTP coordinators and teachers, there are several strategies that we can use to deliver the prevention message effectively. First, ensure to provide a safe and nurturing climate for discussion. There are a wide array of options that you can choose. First are value-based strategies. These include an individual exercise to evaluate one's protective and risk factors and explore ways to minimize risk factors and increase protective factors. Another is the coat of arms or personal shield showing factors that protect one from substance use. Through this, we can uncover factors related to self-esteem and support system that young people have, which can be a take-off point for further discussion. Next, we can ask students to identify their positions on various issues related to substance use, such as marijuana legalization. We can also make use of decision stories or case scenarios to draw answers to important questions like, what are better ways for you to handle your own loneliness? How should problems be effectively managed? What are the resources that you have to help manage stress? What can you do to improve your self-esteem? What can we do about alcohol advertising? Or how can we prevent community problems and improve community self-esteem? Role plays can also be used to develop life skills such as refusal skills and assertiveness. Through this, we can promote active learning in the behavioral and cognitive levels. Interviews can also be done to explore how community people perceive substance use. Through this, students will be able to understand the issue from various standpoints. Next, service learning can be done by allowing students to reflect on their learning, ask questions, explore the many levels of the problem, make informed decisions, and share the seriousness of substance abuse with friends and communities. This can be a school-wide or a community-wide awareness campaign. In the UP College of Education, we do this during our HAPPY event. HAPPY stands for Health Advocacy, Promotion, and Instruction event. Bus sessions or small groups promotes connectedness and social support. It helps students realize that managing the drug issue is a collective effort. We can also ask the class to research the drug problem at school, in the community, or in the sports and entertainment fields, or resolve hypothetical school situations involving drug use, and let them analyze the consequences not only to the school but also to the community. We can also make use of the drug literacy framework. We can provide videos or add triggers for opening the discussion. For example, alcohol advertisements can be shown to allow students to analyze how these advertisements use propaganda techniques to sell their message and entice people to drink. It can further be expanded to how societal values and cultural factors impact alcohol use. We can challenge our students to make a health contract or a personal commitment. Helping them make a simple action plan can facilitate immediate application of learning. These activities will help foster critical thinking about the consequences of risk-taking actions and about youth's important role in society. As we continue to find ways to make this world a better place to live in, let us look within ourselves first and let this radiate to our family, our friends, and our community. Let us continue to inspire, empower, and act collectively for a healthier world.